If your hair started thinning and you cannot figure out why, I want you to walk into your bathroom and look at your medicine cabinet, because the answer may be sitting right there on the shelf. Here is what almost nobody realizes. Some of the most commonly prescribed medications in America every single morning without a second thought list hair loss as a documented side effect. And here is the cruel part, the reason nobody ever connects the two. The hair loss usually does not start when you start the pill. It starts 2 to 3 months later, long after you have stopped associating the two events, so the thought never even crosses your mind. Today, I'm going to walk you through the 5 most common medication culprits I see, from least to most prescribed, exactly how each one affects your hair, and what to do about it. Stay with me to the end, because the number 1 on this list sits in roughly 40 million American medicine cabinets right now. Your doctor may never have mentioned this. Not because they are hiding it, because appointments are too short, and hair rarely makes the list of things there is time to discuss. I'm Dr. Alan Brooks. I have spent 35 years as a board-certified dermatologist focused on hair and scalp, and more than 10,000 patients have sat across my desk. And this is one of the most satisfying patterns I have ever learned to spot, because it so often has a real solution. A patient would come in, distressed, insisting nothing in their life had changed, and their hair was falling out anyway. And I learned to ask one question that other doctors rarely think to ask. What medications are you taking, and when exactly did you start them? Again and again we would count backward, and there it was, a new prescription or a dose change, 2 or 3 months before the shedding began. Nobody had connected them, because the gap in time hides the link perfectly. This channel is where I say what I never have time to say in a 15-minute visit. Maybe this is exactly where you are. Your hair started coming out and you have blamed your age, your stress, your diet, your shampoo. You have bought the supplements and changed the products, and nothing has helped because you have been treating the wrong thing entirely. And underneath it there is a quiet frustration because you feel like you are missing something obvious. You may well be. And the good news is that this particular cause is one of the most fixable on the entire list, once you know to look for it. But before I go a single step further, I need to say something as clearly and as strongly as I possibly can, and I'm going to repeat it more than once in this video, because it matters more than anything else I will tell you today. Nothing in this video is a reason to stop taking a medication your doctor prescribed. Not one word of it. The medications I am about to discuss treat serious conditions: high blood pressure, high cholesterol, blood clots, thyroid disease, depression, and stopping them on your own can be far more dangerous than any amount of hair loss. People have suffered strokes, heart attacks, and worse by quitting these drugs without guidance. So let me be direct about what this video is actually for. It is so that you can walk into your doctor's office informed and say, I have noticed my hair thinning since starting this. Is there an alternative within the same class, or a dose adjustment worth considering? That conversation is the goal. Quitting is never the goal. Please hold on to that as we go. Now let me explain the mechanism, because once you understand it, the 2 to 3 month delay stops being mysterious and starts being the biggest clue you have. Your hair grows in cycles. At any moment, roughly 90% of your follicles are in an active growing phase, and about 10% are resting, waiting to release their hair so a new one can begin. That balance is what keeps your density steady. Now, certain medications interfere with the rapidly dividing cells in your hair follicles, or shift your hormonal and nutritional balance in ways your follicles are sensitive to. And your follicles respond to that disruption in a very specific way. Instead of dying, a large batch of them prematurely abandon the growing phase and all shift into the resting phase at once. That is the crucial event, and here is the thing. It is completely invisible when it happens. The hair is still on your head. It is just resting. It takes those follicles roughly 2 to 3 months to complete their resting phase and finally release their hairs, and when they do, they release them together, in a wave. That is when you suddenly see the shedding in the shower and on the pillow, and by then, you have entirely forgotten about the prescription you started back in the spring. Doctors call this drug-induced telogen effluvium. Think of it like a factory where a disruption causes a large batch of workers to quietly walk off the line. Nothing looks wrong at first. The effect only shows up months later, when the shelves come up empty all at once. And here is the genuinely hopeful part, the part I want you to hold on to. This kind of shedding is almost always temporary and reversible. The follicles are not dead. They were pushed into resting early, and when the trigger is addressed, they very often go right back to growing. So let us go through the 5, from least commonly prescribed to most. And remember, spotting your medication on this list is not a reason to panic or to stop. It is a reason to have a conversation. Number 5 is the class of antidepressants, particularly the group known as SSRIs, with common examples including sertraline, fluoxetine, and paroxetine. These are enormously helpful medications for a great many people, and I want to be careful here, because mental health is not something to gamble with over hair. But hair loss is a recognized, if uncommon, side effect, and it works through exactly the mechanism I described, pushing follicles into their resting phase early and producing a shed 2 to 3 months down the line. The reason this one is worth knowing is that people rarely suspect it, because their mood has improved and the medication feels like it is working, which it is. The common mistake, and it worries me every time, is someone quietly stopping their antidepressant because of hair, which can be genuinely dangerous for their mental health and can cause serious withdrawal effects. Please do not do that. What you can do is bring it up, because the effect varies between individual medications within this class, and your prescriber may have an alternative that suits you just as well without the same effect on your hair. That is a conversation, not a decision you make alone. Number 4 is the blood thinners, or anticoagulants, with warfarin and heparin being the classic examples. This connection is quite well documented, and again it follows the same pattern: a diffuse thinning all over the scalp beginning a couple of months after starting or changing the dose. These medications are preventing blood clots, strokes, and pulmonary embolisms, which means they are, quite literally, keeping people alive. So this is another one where stopping is simply not on the table. The mistake I want you to avoid here is assuming that because you cannot stop the medication, there is nothing at all you can do. That is not true. There are often different anticoagulant options, and there are things you can do to support your hair through it: gentle handling, good nutrition, and patience, because in many cases, the shedding stabilizes over time, even while the medication continues. Knowing the cause also removes the fear, which matters more than people think. Understanding that your hair loss has an identified temporary reason is very different from lying awake wondering if you are going bald forever, two of the most commonly prescribed classes left. And these are the ones I want you to pay closest attention to. Because if you are over 50, there is a very good chance one of them is in your cabinet right now. But first, do something for me. Type in the comments which medications you take, and whether your hair thinning started within a few months of beginning one of them. And tell me your age. I have a feeling a lot of you are about to count backward on a calendar and have a small moment of realization, and I want you to see how many others are having it right beside you. Number 3 is blood pressure medication, and specifically the class called beta blockers, with metoprolol, propranolol, and atenolol as common examples, though other blood pressure drugs including ACE inhibitors have also been associated with hair thinning. This one lands hard on our age group, because blood pressure medication is one of the most prescribed categories in the country for people over 50. Beta blockers have a documented association with hair loss, again through that same delayed shedding pattern. The mistake here is the most dangerous on the entire list. So let me be blunt. Uncontrolled high blood pressure causes strokes and heart attacks. It is a silent, serious condition, and the medication is protecting your brain and your heart. Never ever stop or skip a blood pressure medication because of hair. What you can do is raise it with your doctor, because blood pressure has many drug classes and many individual options within each class. And it is often entirely possible to find an alternative that controls your pressure just as well. Your doctor cannot offer you that alternative if they do not know the hair loss is bothering you. So tell them. Number 2 is thyroid medication, most commonly levothyroxine. And this one deserves special attention because it is genuinely paradoxical, and it confuses almost everyone. Here is the paradox. An underactive thyroid causes hair loss. That is one of its classic symptoms. So people begin thyroid medication partly to fix their hair, and then find themselves shedding anyway, which feels like a cruel joke. There are 2 things happening. First, starting the medication is itself a metabolic shift that can trigger a temporary shed as your body recalibrates, which typically settles. Second, and this is the important one, if the dose is too high, if you're being slightly over-replaced, that pushes you toward an overactive thyroid state, and an overactive thyroid also causes hair loss. So both too little and too much thyroid hormone thin your hair. And the window in between is where your hair is happiest. The mistake here is assuming that any shedding on thyroid medication is just how it is. Very often it is a signal that your levels need rechecking. This is one of the most fixable situations on this entire list, because the answer may simply be a blood test and a small dose adjustment. If you take thyroid medication and your hair is thinning, ask when your levels were last checked, and ask where in the range you sit. And now, number 1, the medication class I promised you at the start, the one sitting in roughly 40 million American medicine cabinets right now. These are the statins, the cholesterol-lowering drugs, with atorvastatin, simvastatin, and rosuvastatin among the most common. Statins are one of the most widely prescribed medication classes in the entire country, and they land squarely on our age group because cholesterol management ramps up exactly in the years when hair also starts to thin. That overlap is precisely why the connection gets missed. Someone turns 55, starts a statin, and a few months later their hair starts thinning, and they attribute all of it to aging, because both things happened around the same age. Hair thinning is a recognized, though not common, side effect of this class. Let me tell you about James, 60, a patient of mine who came to me convinced his hair loss was purely genetic, resigned to it, just wanting to know if anything could be done. But something in his story did not fit, because it had come on rather suddenly rather than creeping in over years. So I asked my question. What did you start, and when? He thought about it, and mentioned that his doctor had put him on a cholesterol medication, and when we counted back, it had been about 3 months before the shedding began. He had never once connected them. And here is what he did right, and what I want you to do. He did not stop the medication. He went back to his own physician, explained the timing, and together they reviewed his options. His doctor moved him to a different medication within the same therapeutic goal, keeping his cholesterol properly managed, and over the following months his shedding settled and his density gradually recovered. His cholesterol stayed controlled the whole time. The mistake here is assuming that because your hair loss started in your 50s, it must be age. Sometimes it is age, but sometimes it is a prescription that started 3 months earlier, and the only way to know is to look. So here's exactly what to do with all of this, step by step. First, make a list. Write down every medication and supplement you take, prescription and over-the-counter, along with the date you started each one and any dose changes. Second, take out a calendar and count backward from when your hair loss began. You are looking for anything that started or changed roughly 2 to 4 months before the shedding started, because that delay is the fingerprint of this whole process. Third, and this is the entire point of the video, take that list to your doctor and have the conversation. The exact words are simple. I have noticed my hair thinning since starting this medication. Is there an alternative within the same class, or a dose adjustment that might work for me? That single sentence turns a rushed appointment into a productive one, and it opens a door that stays closed if you never mention it. Fourth, while you work on that, support your hair with the basics: gentle washing, good protein and nutrition, and no harsh treatments, so you are protecting the hair you have. And 2 practical tips. First, be aware that the same conversation is worth having about newer medications too, including some weight loss drugs, because rapid weight loss itself is a well-known trigger for exactly this kind of shedding. Second, take a dated photo of your scalp now, so that when a change is made, you have an honest before to compare against. One thing, doctor, to viewer, and I will say it once more because it is the most important sentence in this video. Do not stop, start, or adjust any medication based on this video. These drugs treat serious conditions, and stopping them can be far more harmful than hair loss. Everything here is for understanding, so you can have a better conversation with the doctor who knows your full history. Also understand that hair loss has many causes, and your medication may not be the culprit at all. And if your hair is coming out suddenly, in patches, or alongside other symptoms, please see a doctor promptly, because that deserves a proper look. I am a doctor, but I am not your doctor. Now, one last honest word, because this is where the real hope in this video lives. If your hair loss is being driven by a medication, then you are not watching an irreversible genetic process unfold. You are looking at a temporary reversible shed from follicles that are alive and resting, waiting for the trigger to be addressed. And once it is addressed, whether through a change your doctor makes or simply through your body adapting over time, that hair very often comes back. But it takes patience, because those follicles have to finish resting and grow out again. So expect the shedding to settle over a couple of months and the density to return gradually over 6 months to a year. The people who solve this are never the ones who panicked and quit their prescriptions. They are the ones who noticed the timing, asked the right question, and worked with their doctor instead of around them. Because this was never only about hair. It is about understanding your own body well enough to advocate for yourself in a system that moves too fast, and knowing which questions to ask. So go make that list tonight, count backward on the calendar, and come back and tell me in the comments what you find. Type your age too. I read every single one. Take care of yourself. I will see you in the next one.